The system is broken. I wanted to fix it. I wanted to take care of the people that were out there struggling because they couldn't afford the surgeries. What really hit home one day was a gentleman showed up to my office. He had been diagnosed with cancer, and I was helping him get taken care of. He had a check from his 401k that he had borrowed against so that he could pay off his medical bills. And he said, I just wanted you to see this in person. Because of you and my employer's benefit, I don't have to use this. And he tore the check up in front of me. And he said, if I do not win this battle, I don't have to leave my family in financial ruin. That said it all.
Welcome to Patients Win, the podcast where we flip the script on healthcare. In a system that often feels overwhelming, we're here to share stories, tools, and community showing how patients win. In every episode, we dive into real-world examples of resilience, expert insights, and breakthroughs that are putting power back into your hands. Whether you're a provider, a patient, a broker, or a plan sponsor, this is your home for hope and actionable strategy. I'm your host, Troy Reichert, and my co-host, Dr. Jonathan Bushman, and it's time to stop the madness and start winning. Today, we welcome our friend, a nurse, and the president of Connect Benefit, Ms. Tracy Creger. Tracy, how are you today?
I am good. How are you?
Oh, doing great, thanks. Dr. Bushman, how's the life for you?
It's been great. Tracy, thanks for joining us today. We had a great time recently at the U-Powered Symposium, had a chance to connect and dig in a little bit in the work that you've been doing, and excited about today's conversation.
I appreciate you guys asking me to be on here.
Well, it was risky. But we decided we could do it anyway.
It's always risky when you get me on camera.
You know, John, ever since we started the podcast, I've been hopeful, excited about having Tracy on. It's interesting. The three of us met, I think about 7 years ago, Tracy. We were actually doing an event in Dr. Bushman's hometown. And Tracy and I went out there to make the presentation, and lo and behold, Dr. Bushman was one of the attendees, and that's how the three of us met. Literally, there's been a lot of water under the bridge since then, but it's all been good, for sure.
Right. I think we've fallen off the bridge a few times, but we've always managed to climb back up.
Yeah, that's right.
That's right. That's right. You know, it's crazy too. I think about that. Troy, I just celebrated 7 years in independence and DPC, and that was within the first month of being independent. I was new. I didn't know what I didn't know yet. It was kind of interesting. That was how you and I had first met. Tracy was there. There were actually quite a few people in that room that even today, now I look back and I go, oh, wow, we've all come a long ways. We all have had our respective growth and our respective place in this healthcare ecosystem here in Oklahoma and beyond. It's interesting, and I'm excited to kind of dig in a little bit, Tracy, about your beginnings and what it is you do and the kind of difference you're able to make in patients' lives.
Well, first of all, Jonathan, I want you to know I'm just happy that I was here along your way to educate you.
Oh, I need it.
Yeah, I helped you get that start. I know I did.
Yeah. Keep it coming.
Well, Jonathan, certainly Tracy had the beginning for both of us, educating both of us. Tracy, take us back to the start. Take us back to the beginning when you sort of had that watershed moment, that aha moment where you're like, I can't do this anymore. I've got to do something different. Take us back to that start.
Actually, it is in nursing is where I had my aha moment. I was naive enough to think that if you had insurance that things were golden and that you should get any kind of care you wanted. Now, I was young back then and naive, so that made a deadly combination. But it didn't take long. I think my aha moment was in oncology, and I would have patients come in and they had not had the testing or the medications or other things that the doctor had prescribed at the last visit. And when I asked why, they said they couldn't afford it. And I just did not at that time understand how you couldn't afford something when you had insurance. I wasn't using the insurance except for wellness stuff at the time because I was younger. And I just thought it was like a magic golden ticket and you could get taken care of as long as you paid those premiums. So when my patients were coming in and telling me that they couldn't afford the testing or they were hungry because they did do the testing and they couldn't afford the groceries or the medications, it really stopped me in my tracks. And I realized right then that I had to find out why, where the system was messed up and why our insured people were going without care. I had to know why. So at that point, I started working for an insurance company, an independent TPA in Oklahoma, and I learned the claims aspect of it. I learned the stop loss. I learned the case management, everything that I possibly could to dig a little bit deeper and to figure out where things are broken. And I found out really quick it's the whole system was broken. I kind of made it a point I wanted to fix it. I wanted to take care of the people that were out there struggling and working hard and living off of pain meds and ibuprofen just to get through a day because they couldn't afford the surgeries.
So that led you on a whole new journey with that TPA into the area of direct contracts where all of us live now. Tell us a little bit about that part of your journey, Tracy, because you discovered something. You said, hey, people can't get care. They can't afford it. So what do I do about it? And that's really when you came up with this idea, hey, I can help them get care in a whole different way.
Well, I actually was kind of brought into it by Dr. Keith Smith, had the Surgery Center of Oklahoma. He had just posted his pricing online, and Oklahoma County wanted to be a part of that. And I was working with Oklahoma County to try to help them get care over at the Surgery Center of Oklahoma. So I got introduced to Dr. Keith Smith, and he was a fountain of information for me. I held on to every breath that man said. Some of it I couldn't repeat, but most of it was just earth shattering for me. It was groundbreaking. As I would get calls from my members wanting services, there were some things that they couldn't do at the Surgery Center of Oklahoma. So that made me realize that, hey, I need to grow this because if they can't get it there, they're going to go back to the insurance world and have to go meet those deductibles and those out of pockets and go into possible medical bankruptcy for these other services. So I started reaching out. And being a nurse for as long as I had in this area, I knew a lot of people that opened up a lot of doors for me. Keith Smith opened up a lot of doors for me. Jay Kempton. I just held on to every bit of what I could learn from the whole process. The insurance, the nursing, the acquaintances, everything until I got to where I felt like I had a full broad service and I could take the patients from the point of diagnosis all the way through their care and recovery, and they did not have to reach in their wallet and go bankrupt.
Well, you highlight a couple of really important aspects of what we do, not only here, but in our business life, all three of us. We spend time educating people. We help them understand that they have choices and they have alternatives, and we'll get more into that. But you also highlight the fact about relationships. The three of us, our relationship that started almost 7 years ago, you talk about Dr. Keith Smith and others. Now the three of us literally travel the country with our clients, with events and things like that to help people understand what the choices are, what the ramifications of their choices are, and that there are some alternatives. That's really awesome. So in your role, when you discovered this, you started working with Oklahoma County, you started working with Dr. Keith Smith. What did you set up and what impact did that have for not only the plans, but the members themselves?
Yeah, so what we set up was that the discounts were deep enough with direct contracts
Mhm.
that the employers could afford to waive the deductibles and the out of pocket expenses for the members. So the members could actually go and have the services, and the plan would pay 100% of it, still with the savings of using a network. So the group was saving money. And it was a very important group at the time because it's taxpayer money too. We were saving money for the employer. We were saving money for the members. And what we really found out is that it was impacting their jobs too. If an employee is not coming to work every day sick or in pain, they're much more productive. It's easier to get people to come work for you if you've got a great benefit plan. And it's easier to retain your employees because they feel like they are actually getting a benefit out of their benefits. It was a full circle moment. What really hit home one day was a gentleman showed up to my office. He had been diagnosed with cancer, and I was helping him get taken care of. He showed up at the office. He had a check from his 401k that he had borrowed against so that he could pay off his medical bills. And he said, I just wanted you to see this in person because of you and my employer's benefit. I don't have to use this. And he tore the check up in front of me.
Oh, my word.
And he said, I don't have to leave. If I do not win this battle, I don't have to leave my family in financial ruin. That said it all. I didn't need any other guidance to tell me I was doing the right thing.
Right.
I didn't need any confirmation from anybody at that time. That did it all for me. And even now, I still get chills thinking about that man and his family.
What an incredible story.
Yeah, it's amazing. It's amazing. And we've had, of course, direct primary care is a form of direct contract, right? We're not maybe navigating the surgical specialties and such so much, but that same sort of just reminder, and I'm fortunate to say we get it nearly daily in that patient interaction where just the model itself and or the resources we have in front of us changes the entire dynamic of the care experience, of the next step in care, and the cost in many ways. That's an incredible story. I love it when, again, we go back to our podcast, when patients win, when that literally the confirmation of that happens right in front of you, that's an amazing feeling. It enlivens you. It helps you get up every day and do the work that you do with the passion that you do it.
It's a natural high. It really is. It's one of those where every time you help somebody, you just feel, okay, I'm headed in the right direction. I'm doing the right thing. I am making a change. Unfortunately, the three of us can't make the change all for everybody, but we can sure try. And we can do our part and we can spread the word. That's why we were all in Savannah. And I don't know if anybody on here knows or not, but Dr. Bushman actually won an award
Yes.
for spreading his word and doing his good deed. Congratulations on that.
Yeah, thank you.
But we just got to peck away at it. And the more people that we can get to join this movement, the better off we're all going to be. I know for a fact that my company has grown tremendously since I started it. And it's word of mouth. It's members going back to the water cooler and saying, hey, I just had my shoulder surgery. I didn't have to pay anything. I got great care. It's people saying, hey, I didn't know what was going on. So I called my nurse navigator and they helped me and they told me what to expect and they started setting the path to go there. It's those kind of conversations that make a change.
Absolutely. Well, Tracy, you set that up with Oklahoma County, Dr. Keith Smith at that TPA, and fast forward now, because you've actually done that 2 other times for other TPAs, and now you've got your own company called Connect Benefits. So tell us a little bit about that process. How do people engage with you? How do the members call your care navigators, and why? Again, we talked a little bit about why, but let's talk some more about that. But tell us a little bit more about your company, the process, and what you do.
What we do is we do true concierge nurse navigation. We work directly with self-insured employers. Their members will call us if they need anything, if they don't understand their insurance, if they don't know where to start, if they need any testing, whatever. We ask them to call us and we will tell them what available contracts we have, what direction that they need to go, that they have choices. We explain their benefits to them because it's not mandatory. It's not something that they have to do. It's a choice. We just make sure that they have an educated thought process that they can understand what choice they're making. So we go over all of that with them. And with that, we decide, if they want to use Connect Benefit, then we help them. We send them a voucher. We make a referral to the provider. doctors. We get them seen. The bills come directly back to Connect Benefit. We send them on to the payers to get paid, and we help those patients with that navigation. Now, when we bring on a group, we actually attend the open enrollment meetings, and we attend the town halls and all of the different sessions that the health fairs, everything that those employers, because we want them to feel that comfort with us so that they will call us and they will ask for the help.
Yep. And typically, Tracy, what does that cost a member?
Nothing.
They don't pay for it monthly. They don't pay it when they go see service. It's typically nothing.
No. No, the employer pays the fees for us, our services, and the members, they can use us unlimited. It doesn't matter. They can call us unlimited. It doesn't matter. And they've never spent $1. So any service that Connect Benefit facilitates is at no cost to those members. So whether it is a doctor's appointment for a specialist, if it's an MRI, if it is surgery, medical equipment, any of that stuff, anything that comes through Connect Benefit is no cost to the members.
This is interesting because I think something that comes up for us, and I'm sure it comes up for you as well, and really each of us in our spaces, in the conversations we have, a very frequent question is, so why aren't more people doing this? But I'm curious from your perspective in the niche that you're in, how would you answer that question? Why aren't more people, why are more employers not doing this?
I think it's twofold. I think one of it is fear of the unknown. I think that's one. I think two is we pay other people to give us suggestions and to guide us. And maybe those other people are not thinking in the way of direct contracts and concierge and DPC and all that. They are more aligned with, maybe their broker is more aligned with Blue Cross Blue Shield or any maybe fully funded. There's always a different reason, but a lot of times you'll hear that the group is too small, and that is not a true statement, not anymore. At one time it used to be, but now we can help members of all sizes. And I really think that it's fear and it's unknown and it's employers trusting people to make those decisions for them that aren't making those.
That's number one, John. That's a great question. And Tracy, I love your answer. Fear. I literally just was on a conversation this morning with a broker, self-funded plan. He's got care navigation. He's got an independent TBA. But you know what? All of those people, with the exception of the broker, he's trying to do the right thing. He's got the CEO's wife that needs a surgery. They know about a direct contract. And yet the other players, the other people they trust, Tracy, are basically preventing him, saying, no, you can't do that. And I'm telling him, go to Stop Loss because Stop Loss knows about this and they will tell you, yes, forget about the TPA, forget about the Care Navigator, go to the Stop Loss and say, this is what I want to do. And they will tell you, do it because
go to who's going to pay that claim.
That's right.
Mm-hmm.
That's right. And unfortunately, there's more of those stories out there than there are the good ones because there's so many different players and there's so many people that employers trust to help them make decisions. And fear of the economy, fear of the care that they're going to receive, fear of, I hear this a lot, am I going to see a big utilization increase if there's no cost? Well, only fixing the things that have been wrong for a really long time and getting them back to good order. But no, there's not a big utilization. After that first getting everybody fixed, they're fine.
I've got one for you there, Tracy. Okay. There's such a thing called elective procedures, right? But people don't elect to get sick or injure themselves. Okay.
They do not.
So
do not.
You can't have higher utilization for something that requires you to be sick or injured. I'm sorry.
Right.
We're not going to choose to do that because we have a financial incentive to be sick or have a surgery.
No, I'm not going to elect for my gallbladder to go bad.
Exactly.
I'm not going to elect that.
And I've only got one. Once you get it once, sorry, we're done.
Exactly.
I can't keep doing it.
So I really get upset whenever I hear that because it's such a gimmick that people are putting out there against what we do. It's trying to negate the good that we're doing by putting doubt in people's minds saying, oh, you're going to see a lot of more claims. You're going to be seeing, a lot of people off for FMLA because they're going to be having more surgeries. I hear it all. I hear it all.
So Tracy, you've been doing this a long time. You've done a lot of contracts, you've done a lot of navigation. Tell us a couple of your best stories. I mean, the one about your patient that had the oncology with the ripped up check, that's incredible. Tell us a couple more stories about the patients winning. Because we could spend the next hour talking about just stories, but tell us your two favorites.
One of them was very recently. I had a infant that could not hear, needed a cochlear implant. He was in another state, and the children's hospital in this state was quoting them almost $100,000. And, that was going to be a huge impact. So I called the member and I told them that I could fly them to Oklahoma City, put them in a nice hotel, and fly them back home, pay for their meals and everything, and it would be no cost to them. And they were like, well, who would be taking care of us? Because we really trust the doctor. And I said, well, okay, let me give you the name of who would be taking care of you. Oh, and by the way, the anesthesiologist is pediatric, so you're going to be safer there. But come to find out, the surgeon that did the baby's surgery trained the doctor that was in the other state that they were going to use. That was major for that baby and for that family, and they did not have that cost. That's one of my favorites.
So
I think
Tracy, how
another
much did the
one,
plan pay for that? It was going to be over 100, so someone's going to pay 100. What did they pay in that situation?
it was somewhere around $40,000.
And the patient paid 0.
The patient paid 0, the plan paid $40,000, and they got a nice little vacation out of it, honestly. So it was all paid for, and it was really nice. And that was one.
And now this patient hears. Now the child hears, right?
Yes.
That's
Yes.
awesome.
And then another one was a patient that did not understand English and was being forced into the hospital systems. He was having cardiac issues. I got wind of him being in the hospital, and I reached out and realized very quickly that he was not understanding me. So I called his son, who was bilingual, and talked to the son and they were very concerned about the finances. They did not know how they were going to cover this, and there was an impending surgery and some transfer because one hospital couldn't do it, so they were going to send them to the mother hospital. I told him, I said, if you're going to be transferred anyway, let's transfer you to one of my facilities, and that way we can stop the bleeding now with the cost. The cost will end once your dad leaves that hospital and goes into our facility. There will be no more cost. And that is another one because it opened my eyes to how quickly someone who does not understand can be put into a system to where he was going to have to probably file medical bankruptcy or something. He was going to be spending a lot of money, and he was scared, and no one had just taken his hand and helped him understand. And nobody had contacted the children. So it was just a little extra step that somebody needed to do on his account. And we got the bills to stop. So that's another one.
That's
Those are just everyday occurrences.
You don't
Yeah,
like what you do you, Tracy?
Not at all. Not at all.
We talk about speaking different languages, and obviously everyone can relate to that when there's an issue there. But I kind of think what we do, honestly, is a different language anyway, right? Because the health literacy, or maybe I should say health insurance literacy across the board is extremely low. And going back to what we were talking about in education, many times it's one-on-one, and how can we get into the larger groups of, as you mentioned, going to the employee election cycle and being there for the employee meetings. That's a big piece to educate them so they know what to do when the time comes. What other kind of methods do you use to educate that may not be so much one-on-one?
So we do a lot of reaching out to members. If I get a pre-certification report and I see that someone's headed down a costly path, then I can reach out to them and explain their benefits to them and help them get moved over to a zero cost path. We do that. We do all kinds of things. We do phone calls, we do text messaging, we do emails. We try to reach these members however we possibly can. We actually signed on a group of truck drivers in order to make sure that they had our our contact information. I had key rings made for them so that they would always have our number handy and there would be no, well, I didn't know the number, so I went on about to the insurance or something. So I will go to pretty much any extreme to make sure that we can help these people.
I've got one more for you, Tracy. I'll give you an extreme thing, and I know that you will do it. I know you will do it. You tape it up on the urinal so these members will see it, and every day they see your information. Actually, that was a little pearl of wisdom that I got from another broker who said, "Man, we could not get these people engaged." And then we started doing that, and it's funny, and I mean, it's kind of grotesque in a sense, but that got their attention. And there was a very male dominant lawyer. We did not know how to reach these guys, and all of a sudden, they started engaging. It's because they
Can
were
you
seeing it multiple
imagine
times a
going to
day.
the bathroom and seeing my face on
Oh,
there?
no, we don't want your face on there, Tracy. No.
Oh, okay. I sure say that would I mean, seeing, hey, are you having problems urinating? Here, call Connect Benefit or,
There you go.
I do want to say though, Jonathan, that with what you do with DPC and with what Troy does of speaking the word and what I do of navigating and helping the members, we all work so well getting the message out to everybody. And I feel like we touch very many people by doing this. Troy gets the word out. They get DPC. They go to you. They get all of their services. They get one-on-one care. And then if something's outside of your wheelhouse that you need to refer it on, you refer it back through me and I pick up the baton. There's no gaps. There's no holes or potholes for that member to fall down because we have sealed it up. And that is most important is if I go to a doctor and I don't understand the system and they tell me to go down the hall, I'm going to go down the hall. I'm not going to. Now, I know if I go see Dr. Bushman, he's going to say, well, I'm going to do this, this, and this here, and then I'm going to call and get you over to Connect Benefit for this MRI or whatever. We've sealed that gap. We have closed it to where that member is still getting the care they need, but it's very easy for them to fall off the grid. Going down that hall, they could say, oh, I can't afford this, and just keep going on out to the parking lot.
Tracy, how many patients have called you in the hallway and they didn't go in that other door and you walked them through that?
Hundreds. We have texting now, and we have people on the table in their little cute paper gowns saying, my doctor wants me to do this. And we get them taken care of so that by the time the nurse comes in to schedule, they can say, oh, I've already got it taken care of.
Oh, that's awesome. That's great.
But, guys, the system is broken. And it's not just the fact that that the patients don't understand. It's the fact that the people make it hard to understand. If you call and you want to know, if you're financially responsible and you say, oh, I need my gallbladder taken out, hospital, what is my cost going to be? They're not going to tell you. And the first thing they say is, well, what insurance do you have? Well, why does that matter? Your cost should be the same no matter what insurance I have. So whenever they call and they try to get a cost and they can't get a cost, they go in blind and then they don't know the cost until they get these bills and these EOBs. That makes them vulnerable because now they owe their soul to the system of trying to pay this money or get garnished or collections or whatever. Whenever somebody calls me and they say, I need my gallbladder taken out. How much is it going to cost? I have a number and I say, it's nothing for you and your employer is going to pay this amount. And our vouchers even say you owe nothing and your employer will be responsible for this amount. I'm proud of that pricing. I want everybody to know that cost.
It's interesting, Tracy, too. We've got into, of course, you're doing the care navigation. People are becoming, and sometimes they know the cash rate. The cash rates are out there in some of the surgery centers, et cetera. There's this idea that, hey, we can do this differently than traditional insurance. We in direct primary care are doing the same thing, saying, hey, guess what? We can actually do something better for you if we don't involve that. We can actually save you money in this place if we don't involve that. Now, enter GLP-1s over the last several years, and particularly the last 2 years. And I think the general public is just becoming much, much more aware that there is a cash economy in healthcare.
Yes.
And I'm anxious to see, we're living it You're living it. GLP-1's taken this honestly to another level in the pharmaceuticals of saying to the general public, hey, not only is insurance a mess, but there are ways to do this without involving them. And we actually get easier, better, lower cost care. And if we can do that, obviously the quality and outcomes follow. So I'm anxious to see that. I'm anxious to see your business grow because people recognize that, oh yeah, this is being done. And it's been done for a decade, but we've been under the radar to the mass majority of people.
Yes, I agree completely. I'm very excited about watching how this has grown. This has grown tremendously from back in the day when I first started. There's so many more people. There's conventions now that there didn't used to be. It's just amazing to watch. Do we have it under control yet? No. But we kind of knew that we were going to have to eat this elephant one bite at a time. And I think I started at the tail end of it. I don't even know that I'm up to the hip yet.
Well,
Yeah.
Tracy, this has been awesome. In terms of, we've shared some great stories. If you had one message to leave, and this could be the same message or it could be different, but if you had a message to leave a plan sponsor, a message for the broker and a message for the patients, and maybe they're different, but what would that one message be for each of those three categories? Because those are the people that are affected every day by what you and me and Dr. Bushman do.
So I think my message to the brokers would be do what's right for the client. Do what's right for the client. Don't be idle. Go out and do your research and bring something new to the clients. I think my message to the clients is don't be afraid to ask questions. Don't be afraid to explore the opportunities, and don't be afraid to make the changes.
That's very good.
I don't know. I mean, she kind of claimed to be the one to teach me things. So, how am I supposed to give her words of wisdom? This is amazing. No, I love the work that you're doing, Tracy. And when I think about our work, not just what Troy and I do, but I think about kind of the whole healthcare team, if you will, getting into benefits advising gave me this whole other perspective of what was happening at the clinical level. And you were talking about this earlier, and the analogy that came to my head was that there's so many of us that are operating like children in healthcare. And children are taught and they're given more and more context. They grow. And at some point, they start making decisions of
Yep.
their own and gaining the agency and autonomy that they need to go through life, right? Why would we ever treat our patients and specifically physicians? I feel this way about physicians as well, at least in the terms of understanding the finance, business, contracting, incentives. Many of them are still at that elementary level where they know what they need to know for a moment, but their education, as I've grown in the education and I've learned from both of you, but many people in this space I've learned from, and you start seeing the bigger picture. Now we can think critically. Now we can be better to those around us. And I think, again, Troy and I love educating, but it doesn't stop, right?
Mhm.
Like we're continually educated and it improves our ability to educate. I know physicians listening to this can understand that because you go from a first year medical student not really realizing what you've signed up for into third year, fourth year internship. Now you got your license, you're moonlighting and resident, this progression, and you never want it to stop, right? You never want it to stop. And just appreciate the work that you're doing. And really, it's a call to action to all of us, but to our listeners as well, is just continually educate yourself because number one, there's more to learn. And number two, there's so many people out there who are doing what's right for patients, who are making sure the patients win at the end of the day. So again, thanks for joining us, Tracy. It's been a
Thank you
pleasure.
guys.
You
It's
were
been a
pretty tame
pleasure.
today. That's because you're on camera, but we can have fun with that later. So
Okay. All right. Thank you
yeah,
guys.
Thanks, Tracy.
absolutely.
Well, everybody, thanks for joining our guest, Tracy Creger, and Patients Win, the podcast where healthcare gets real as we bring you the voices, stories, and strategies to change how healthcare is delivered, paid for, and experienced.